Chairwoman, also Commission. My name is Nick Easley. I'm CEO of 3C Comprehensive Cannabis Consulting. We're based out of Denver, Colorado, working 14 states, 3 countries. Thanks for the opportunity to share some of our comments after your review. First of all, when it comes to extraction, we've seen multiple problems from mixed hydrocarbon extraction in the industry. Propane, hexane, butane. It's not that these are bad solvents. Our industry is just not responsible enough to use them without proper guidance. I'd like that to be a consideration. I'd also invite you to look like Americans for Safe Access with patient-focused certification. They have a great 94-page recommendation for rules for regulators that outline a lot of safety standards, because this does come down to patients, and we do need to keep this patient-focused. I would like to see some sort of third-party certification. Essentially, we don't have OSHA, the EPA, USDA, EPA actually helping to guide these programs. Follow some of those federal oversights, even though these regulatory bodies cannot enforce their policies on us. I would love to see some state classes for pesticide applicator training, worker protective standards, personal protective equipment for pesticides, including pesticide lists. In 8 of the states that we work in, we've worked with the Department of Ag to actually create some of those programs. If you don't put these in place now, it is a train wreck later and dangerous for the patients and the workers. As a few individuals have mentioned, I've seen that diversity requirements are an absolute mandatory requirement for any industry moving forward in cannabis. This is an extremely kind of biased system from all the past industries. We saw what happened in Maryland, 15 licenses, 15 rich white gentlemen. It's caused a delay in the entire program. There are patients still suffering because of this. And based on the diversity of this state, I would like to see some sort of diversity requirements to actually give licenses to businesses of diverse backgrounds. Currently, we need some clarity with ownership on cap table versus the ownership of individuals. Right now, the way that it's currently stated, it could potentially be 6 people from Arkansas with 1% ownership, 94% out of state. Keep the jobs here, keep the ownership here, keep the capital here if possible. Bring the knowledge from out of state. And you can bring the Department of Agriculture to the table. This is an agricultural commodity, and growers should grow, processors should process, and retailers should dispense. We've seen catastrophes in the past in other markets when you have dispensaries growing plants. I know that's a different commission determining this, but I would like to look at that. Also, like the point-of-sale systems and tracking, look to what's worked in other states and has not worked. You look like MJ Freeway. There's plenty of examples of what works and does not work in this. When it comes to disposal of waste, you currently have it for cultivation facilities. There's nothing really specific when it comes to extraction and dispensaries. How do you have expiration dates? How do those products get destroyed? It's not just glass. Like in Colorado, we saw a lot of brownies go to a high school from a dispensary dumpster. We do not want to see those things happening. Also, the last comment, I know this is the natural state, so some of those safety testing standards for the type of pesticides used, fertilizers used, growth hormone regulators, how wastewater is going from like hydroponic facilities. These things need to be looked at, keep the natural state natural. And for the labs, the gatekeepers in the industry, there need to be much more standards for the laboratory language because they are the gatekeepers. You shouldn't have 19 labs like Colorado where they can shop lab to lab to lab for more potency or that it won't fail a product. Thank you very much.